Thanks to Duncan and his colleagues for this important motion. This debate is about whether we have safe and adequate staffing levels in our hospitals and our health services, and whether the pay and number strategy is in fact an embargo by another name to prevent the recruitment necessary in order to reach the safe and adequate staffing levels in order to ensure patient safety and provide the treatment for the patients that require it. Now, we have a sort of mystery here. Forza referred to the mystery of the disappearing jobs in the health service. We also have the mystery of how the government tell us we've record levels of recruitment and we have some of the best staffing levels, apparently, in nursing anywhere in Europe. And then we have what the health workers say, which says exactly the opposite, that they're chronically understaffed in every single area of the health service, that they're completely demoralised, and that patient safety is being seriously jeopardised across the health service. Now, I'll tell you just from the off, I believe the health workers, not the minister. And, you know, there is a reason why the INMO and Forza are balloting for industrial action. These are conscientious people. They don't want or like going out on strike. They're balloting because they are demoralised, they are stressed, they are overworked, and they are worried about the safety of their patients. The hospital consultants tell us a different story. Waiting lists will increase by 74,700 by the end of 2024 if current trends increase, an increase of 11% compared to the start of the year. They say that 746,000 people are waiting for outpatient appointments, and there are now a record 913,000 people on some form of public hospital or health waiting list. I talked to Cancer Care. And they're coming in here today, but I've been talking to them over the last few weeks because we've raised this repeatedly. I talked to the radiation therapists again this morning just to confirm before this debate what's actually going on in Cancer Care. There's been significant capital investment in machinery in Galway, in Cork, and in St. Luke's, among other places. But there's no staff to run the machines. Many of the machines. They are sitting idle. And therefore the government is having to pay out €7 million to outsource cancer treatment to the private sector, but they won't recruit the staff necessary because of the pay and numbers strategy. And the consequence of this is, if you're diagnosed with cancer, you are supposed to get treatment within 3 weeks. There's a target that 90% of cases should meet that target. Pre-COVID, we were at 80% to meeting that target. It's now down to 60%. 4 out of 10 people are not getting the timely treatment they need when we are talking about a threat to their life, conditions that are a threat to their life. The radiotherapists are working 12-hour days, overworked, overstretched. And the government says, oh no, but we're trying to recruit. But again, the health workers, or even the advertisements in the hospitals themselves, tell us a different story. I got a mess on foot of St. Michael's hospital workers in my area and Loughlinstown coming to me and saying we are chronically understaffed, not safe patient levels and so on. We had a meeting, we protested, we asked questions, and then we got a letter saying we're going to authorise 21 posts because there was 21 less than was needed in the hospital. How many of them are actually being advertised? This is a month after they told us that they are trying to recruit these 21 posts. 2 nursing jobs advertised. There's 5 vacant health and social care professional jobs acknowledged by the HSE. How many jobs being advertised on the website? None. So somebody's playing games here. The government says they're trying to recruit people, but in actuality, they're not advertising the jobs. They're not trying to recruit people because of the pay and number strategy. And they're not backfilling posts if people leave, leaving places chronically understaffed and patient safety jeopardised. The government are deceiving the public.
Independent Group.